June 21st marked the 100th day that the State Emergency Operations Center has been activated for the COVID-19 pandemic response. This is the longest continuous activation in Wisconsin history, and boy, have the people at the SEOC and their many public and private partners accomplished a lot in these last 100 days. So today I want to talk a bit about those accomplishments and everything our folks at the SEOC have been working on over the past few months. In the early stages of the pandemic, the SEOC took measures to help flatten the curve and box in the virus. Preparing for outbreaks in Wisconsin was one of the first priorities of the SEOC, so they set up isolation facilities so folks could safely isolate themselves away from others. They also took early and continued action to ensure healthcare workers and facilities had the tools, resources, beds, ventilators, and other supplies they need to tackle COVID-19, and to ensure they were well equipped to care for patients. But we also had to ensure that in the event of an outbreak, we could protect the folks on the front lines by responding to COVID-19, by helping get personal protective equipment to the folks who need it the most. To date, the SEOC has distributed more than 45,000 N95 and 97,000 KN95 masks, nearly 8 million medical and surgical masks, and more than 240,000 face shields and goggles, and 521,000 medical gowns to healthcare providers. They also installed and operated the Battelle system to decontaminate and reuse N95 respirators, which have been a scarce resource in Wisconsin and across our country since we started battling this virus months ago. Increasing testing has also been a critical part of our state's response to the COVID-19 pandemic and a pillar of the Badger Bounce Back Plan. In 100 days, the SEOC took our lab capacity from the ability to perform 0 COVID-19 tests in early March to the capacity to perform 17,668 tests daily. And because of their good work, as of yesterday, we have tested 491,702 people in Wisconsin, including those at nursing homes, hospitals, clinics, and local and tribal health departments. But in order to make sure our testing efforts were meaningful, we also had to make sure that we bolstered our contact tracing to prevent folks who tested positive from exposing family members and neighbors. The SEOC used our increased testing efforts to help protect folks who might have been exposed to COVID-19 and minimize the spread of the virus. We transferred more than 300 state employees from our state agencies and hired more than 200 LTEs to conduct disease and contact investigations, and to date, we have conducted more than 9,000 disease and contact investigations to help contain the spread of COVID-19 in Wisconsin. As the SEOC moves forward, they are continuing to take steps to ensure the safe reopening of Wisconsin and to prepare for any future surges, including continuing to provide guidance and assistance to businesses and local and tribal health departments across the state, as well as working with the Department of Public Instruction to ensure our kids can go back to school safely this fall. As we continue to battle the COVID-19 pandemic, the SEOC remains vital in protecting the health and safety of Wisconsinites.